To measure extension range of motion of the first carpometacarpal joint using a goniometer, the patient is seated with the forearm supinated. The upper extremity is supported on the table and the wrist and hand are in a neutral position. The thumb is positioned along the lateral side of the second metacarpal. During the measurement, the axis of the goniometer is placed over the ventral surface of the first carpometacarpal joint. The stationary arm is aligned with the ventral midline of the radius in the radial head, and the moving arm is aligned with the ventral midline of the first metacarpal.
Mr. Jones, I'm going to measure how much you can move your thumb away from your hand using this device. When I ask you to, I want you to move this thumb away from your hand like this and hold it there. Now move your thumb away from your hand, hold it there,